Does reading a clinical paper feel like you're reading a textbook, but in a foreign language? Does it feel like you're trying to decode the Da Vinci Code? Are you frustrated by the information overload and things being lost in translation? Well, you've come to the right channel, because today you're going to learn 3 things. Number 1, how to identify key points in a clinical trial. Number 2, how to analyze key data points. And number 3, how to formulate meaningful conclusions that you can use in your role, whether that's in medical or sales. Ultimately, this video is going to simplify things and make reading clinical papers feel like doing an escape room or a riddle, but you know where all the clues are hidden. Now, this video could have been done in 5 minutes, but I've made it 20 because I want to give you the context and explain things like p-values, confidence intervals, and share my 5 years of field experience watching, observing how key clinicians critique clinical trials. So what are you waiting for? Put on your lab coat, let's go. Actually, before we get into it, I think it's really important to think about the why. Why are clinical trials so important? Well, in the spirit of Simon Sinek, if we ask ourselves why, it costs millions and billions of dollars to research these medicines and bring them to market. So clearly understanding the statistical and clinical relevance of the results is going to do 2 things for you. Number 1, it's going to give you the confidence in your conversations with clinicians. And number 2, it's going to help you facilitate quality use of medicines, ensuring the right patients get the right medication. Now, if we ask any doctor, I'm sure they would say they practice evidence-based medicine going off the latest clinical research. But this is where the challenge is. Often, clinical data, new trial evidence comes out first. And then there is a lag between change in doctor behavior. And this gap is the bridge that pharma needs to build. And this is your role, to close this gap, to ensure doctors are really going off the latest clinical evidence and using the latest and greatest medicines that we have available for our patients. Oh, and a disclaimer here. This video is purely for educational purposes. I'm not forming or giving advice on whether Ozempic should be used for weight loss. This is purely to help people understand how to break down a clinical paper in 4 easy steps. So if you're a patient that stumbled across this video thinking about using Ozempic, please go and see your doctor, because this is not medical advice. This is purely an educational video about how to read clinical papers. And with that, let's crack into it.
So the paper I've chosen to break down is the STEP trial, which is once weekly semaglutide in adults who are overweight or obese. Now, before we get into it, and with any clinical trial that you read, there are really 4 questions that we want to address. Let me break down the 4 questions for you, and always keep these in mind when you're reading clinical papers, as that's going to help you identify the key points of the paper. So the first point is, why did they do the trial? Secondly, how did they do the trial? Thirdly, what did they find? Fourthly, what do the findings mean? And very nicely, this is actually summarized by different sections of the paper. Where the first question, that's really the abstract. How did they do the trial? That's the method. What did they find? That's the results. What do the findings mean? That's their discussion. So let's just step back and have a look at this paper. I want to talk about level of evidence and what is gold standard. So when we talk about gold standard in terms of medical literature, journals like the New England Journal of Medicine, also known as the NEJM, or journals like the Lancet, are considered tier 1, where they are highly peer-reviewed, and because they undergo so much scrutiny, that is seen as the gold standard. Further, if we scroll down, just on a quick skim, I can see that this trial is a double-blinded trial with quite a significant amount of patients in there. Again, reaffirming the quality and robustness of this trial, where randomized control trials are also considered the gold standard. So before we've even started, I can tell this is going to be quite a robust study for two reasons. One, it's in the New England Journal of Medicine, and two, it's a randomized controlled trial with a significant amount of patients. So let's get stuck into the abstract to understand why they ran this trial. So obesity is a global health challenge, that's fine. They want to see if obese patients can achieve weight loss on a once weekly dose of semaglutide, which is Ozempic. They're using a double-blind trial. They have 1,961 adult patients. With a BMI greater than 30. And do not have diabetes. Randomly assigned in a 2-to-1 ratio over 68 weeks. So roughly 15 months. Interestingly, they are given lifestyle intervention. So I'm assuming told to exercise, eat healthy. Now this is really important. The co-primary endpoints, so what they're really looking to measure, the success of whether weight loss can be achieved with once weekly Ozempic, is a percentage change in body weight and a weight reduction of at least 5%. They wanted to measure whether adults with obesity can achieve weight loss with once weekly semaglutide. And the KPI that they're using is twofold. They're looking at percentage change in weight and also weight reduction of at least 5%. It's going to be a bit more introductory blurb here, but I'm going to delve right into the method. And this is arguably one of the most important parts to read because it will tell you a lot about the patients who were recruited, inclusion criteria, exclusion criteria. It will really give you insight into potentially how biased this trial is. So let's have a look. Randomized, double-blind, placebo-controlled. That's a triple thumbs up from me. They conducted this trial, 129 sites in 16 countries, Asia, Europe, North America, and South America. So they only enrolled adults, which is pretty much all clinical trials. It's very difficult to get under 18-year-olds past ethics committees. They, interestingly, allowed BMI of 30 or under 30 if you had an untreated weight-related coexisting condition. They have randomly assigned patients in a 2-to-1 randomization. That's good for us to know. And so you either got the active Ozempic 2.4 milligram once a week for 68 weeks or a placebo. And then at the 68-week mark, so about 15 months, you went for 7 weeks without receiving any drug or lifestyle intervention. So I think they want to see if the drug has sustained benefit or people just put the weight back on, is my guess. Okay, so every month they were given reduced calorie diet and told to increase their physical activity. Fine with that. And this was recorded. Now, we've answered our second question. RCT, double-blind, placebo-controlled. So, gold standard, let's just say. But actually, we haven't learned a lot about the patient population, and that's what I really want to tease out. So let's keep reading. Now, this is exactly what I want to see. So, characteristics. Age, yeah, middle-aged. Female, you can see, wow, huge number of female patients. That is incredibly skewed towards female. The other thing that I'm interested in is to see, ethnic backgrounds. So again, heavily skewed towards white Anglo-Saxon. Asian population is quite small. So too the black African, even smaller. Most of these guys are most of these ladies are around 105 kilos and pretty even. So not only am I looking at the percentage, I'm also comparing active to placebo. So I don't want to see, they put 75% of women in the Ozempic arm and 75% of men in the placebo. Obviously that's going to skew it. It needs to be even weighting. The mean BMI at baseline is 37. That is quite a large person. Let's look at the breakdown of the BMI. Wow. So 60%, more than half, have a BMI above 35. That is quite a significant number. I'm actually surprised these people do not have diabetes yet with this BMI. Let's see. Apologies. They're pre-diabetic. See, that's my inner clinician kicking in. Blood pressure, lipids. Not too overly concerned with that. Number of coexisting conditions. So when I'm glancing over this, I'm really looking for a sort of outlier number or percentage, and everything seems to be fairly sturdy. 25% female, 75% white, mean weight 105 kilo. Mean BMI was about 38. So they first noticed a change in weight from week 4 with a change of 15% in the Ozempic arm compared to 3% in placebo. Interestingly, it's minus 2.4%, which matches the dosing. Anyways, I do notice some weird things. Let's see these results. So they were saying as early as 4 weeks. So I can see here, you start to see pretty clear separation of the curves, and then, quite significant drop in weight the longer it goes on. You can see here, they started with about 1,900 patients, and as time goes on, it's really important to notice, patients start to drop off. And I would always look at, okay, you started week 0, finishing at 68 weeks, which is about 15 months later. How many are still on compared to day 1? And it's not too bad, so that's okay. So that was their first endpoint they were looking at. Change in body weight. All this looks pretty good, all the rest of this looks pretty good. Clear separation of the curve. In trial data. Participants, weight loss. Okay, so this was the other group they were looking at. How many lost at least 5%? And you can see quite a lot on the Ozempic. The change in weight was about 15 kilos that they lost, compared to 3 or 2.5 in the placebo. So if you got the drug, 44%, almost half, are having nausea. A significant amount also having diarrhea, vomiting, constipation, nasopharyngitis. Under 20%, I'm probably not overly concerned. Let's have a look at placebo. Interestingly, the placebo are reporting quite a high number of nausea, diarrhea, vomiting. Ooh, nasopharyngitis, quite high. Okay. I'm starting to wonder, if these people were having nausea, vomiting, diarrhea, they're obviously not eating. So is this the cause of their weight loss? So remembering that they're looking at the percentage change in body weight, the mean change was 15% on drug versus, I think it was 2% placebo. All right, yep. And the other endpoint was how likely were they to lose 5%, at least 5%, and 86%. Let's be nice, 87% of patient lost had a 5% change in body weight. Okay. Now, our last question. Let's bring it all together. What does this all mean? So in this trial, we found adults with obesity and without diabetes had a mean weight loss of 15%. And this obviously exceeded placebo. The 15% weight loss we observed is substantially greater than a weight loss of 4 to 10%, which is what other anti-obesity medications try to prove. 86% of patients lost at least 5% or more of their baseline body weight. So here we go. This is really good to see. 86% of patients, which we know, had more than 5% change in baseline body weight. And that apparently is a criteria for clinically meaningful response. Weight loss with Ozempic is largely due to reduction in energy intake due to decreased appetite. Liraglutide administered, so one of the other drugs in this class. Apparently, Ozempic is superior to this, showing greater mean placebo-corrected weight reduction, which is good. I'm pretty sure liraglutide belongs to Novo Nordisk anyway, probably just cannibalizing their own medicine. The weight loss lasted longer. Okay, so yeah, you're seeing a bit of superiority. But again, I like this. They're keeping it balanced. The two studies differed in their participant population, and that limits robustness. And you should always, always, always be careful of cross-trial comparison. Ozempic over 68 weeks showed an average of 15% change in body weight and 86% chance of losing more than 5% of body weight, which is both statistically significant and clinically significant. Major safety concerns. GI upset. So there we have it. In about 10 minutes, we've just digested this paper. We know why they did the trial. They wanted to study whether adults with obesity can achieve weight loss on their drug. And they measured that in 2 ways, a percentage change in body weight, and then also they had to lose at least 5% of their total body weight. How they did it, they used gold standard, RCT, double-blind, placebo-controlled, patient population, and equals 1900, so it's quite a lot of patients, although majority were female and white. Mean weight 105 kilos, quite large. What did they find? Yeah, pretty impressive. The mean change in weight was 15% versus 2%, and 87% of patients achieved at least a 5% change. So what does that mean? If we're going off that clinical measure, that achieving at least 5% weight reduction is clinically significant, then their medication is showing that it can achieve that. The major safety concern is nausea, vomiting, and so that's something a clinician should definitely weigh up and be aware of and monitor if they are putting someone on this medication. But anyway, I just want to reiterate, I'm not here to pass judgment on Ozempic or recommendations. I'm here just to show you how to break down a clinical paper.
To summarize, when you're next reading a clinical paper, focus on those 4 key questions, and that's really going to help you extract the key points that you need without getting lost in the weeds. If you like this content, please give a thumbs up. Let me know in the comments below if you still have any other questions. Perhaps there's a clinical trial you'd like to break down together and we can work on this. Or maybe you run journal clubs in your team and there's a new starter who you think would benefit from some of these tips. Please share this video with them and I'll see you on the next one.